Good afternoon, ladies and gentlemen. My name is Bernard Harris. The three of us here are with the Pikes Peak Strategic Group and the AmeriPlan Corporation. We want to direct your attention to expensive medical or rather dental procedures that you may need now or in the future. Specifically root canals and porcelain crowns. A lot of advertisers will throw something out to get your attention and try to reel you in. And give you a price, then, oh, by the way, we've got to add this or add that. We, with the Pikes Peak Strategic Group, we're not going to do that to you. We don't believe in it. But we will tell you up front what you're going to save. Specifically, root canals average $933. That same root canal with us is $375. Now, you need to be sitting down for this one. Porcelain crowns average $1469 with the PPSG and AmeriPlan Corporation $575. Now, what do I want to add to that? You just can't go in and have those specific procedures done and walk out. There is prep work that has to be added in. My partners are going to tell you about that, and because we want to be very upfront with you, but we do want you to keep in mind the significant savings you're going to get with either our Dental Plus or our Deluxe Plus. What do you think, Ed?
Well, I tell you, that's a good intro, Bernard. Thank you for that. And I think we were talking about, I'm going to talk a little bit about the crowns and the root canal, but I want to also direct my attention to those of you who are on Medicare. I get people calling up their own Medicare, and they says, well, what's best, dental insurance or your program? Of course my program is better in many, many cases. And if I get people calling, well, I need a root canal, I need a cleaning, I've been calling around, I've been on the internet, and I've got dental insurance, and I said, oh, well, we can sign you up today, but you're going to have to wait 6 months to a year to get that root canal. Now, you may be in pain or you need a crown right away. With our program, either program here, ladies and gentlemen, our $24.95 program, we can sign you up today and you can use the program today.
Absolutely.
So those of you who are on Medicare in particular, or our military friends out there, or seniors, or the average American out there, we can save you money on crowns. And people tend to put off their dental care, but those of us who've gotten a little older, the three of us sitting here in our 70s or so, we realize that we need to get to the dentist 2 or 3 times a year. It helps with our overall health. But I just want to emphasize to you the fact that I'm not putting down dental insurance. Some of you have it, especially on Medicare, but you need to make the comparisons. If you're in pain now and looking to save money and so forth, you may have dental insurance. The average dental plan for a couple is running around $90 to $100 a month, and then you got to wait to get that root canal bill or that crown. Yeah. With us, you can sign up today for $24.95 for your entire household. We're going to give you dental, vision, prescription, and chiropractic services, and we can get you that membership number. Find a provider in your particular community, and you can go out this afternoon or tomorrow at the latest and get that crown, get that cleaning, get that extraction, whatever you need. What do you think, Bill?
Oh, yes, absolutely. This AmeriPlan has the best support program for all those kind of issues. I think of all those programs you see on TV or here on the radio. One thing I want to comment on, we talked about, is whether your needs are covered by Medicare. Now, basically, Medicare does not include dental and vision.
Right. Correct.
Now, does not mean, it's a fine line, does not mean you can't get some of those services covered by Medicare. But it must be determined to be medically necessary to be covered by Medicare. Now, how is that determined medically necessary? Sometimes, depending on what program you have. Again, we're not knocking supplemental insurance, if dental insurance, depending on what program you have, the procedure for determining that the root canal or the oral dental surgery, whatever you need is medically necessary, is not necessarily only your dentist's opinion. dependent on the program you have. Determine your program may require that a medical doctor determine that this procedure is necessary for your overall general health. Thereby, it should be covered by Medicare. It's just not automatic that your dental needs will be covered by Medicare, because again, Medicare basically does not cover dental and vision. So it must be determined to be medically necessary for you, and the procedure for doing that can vary depending on what insurance you have, what supplement you have, in terms of who certifies that it's medically necessary.
Yes.
Certainly you can't. It must be some medical professional.
Yes.
That may include your doctor plus your dentist.
Mm-hmm.
And again, as Ed just mentioned, you may have some waiting period, some other qualification before it's determined to be medically necessary. But with AmeriPlan, we want to encourage you to look at AmeriPlan because it can save you money. You can use it the same day you sign up. It can cover those areas, root canals and dental surgery, that you don't need a second opinion necessarily, and save you considerable money for only $24.95 per month if you just have the dental program, or if you have the deluxe plan, $39.95 covers all those programs: dental, vision, chiropractic, prescription drugs, everything. It's worth it not to have to go through a procedure of determining what is medically necessary for you as a secondary effort for Medicare coverage. So call us and we'll be happy to discuss it with you in great detail. So in the meantime, look at your 2019 Medicare guide. It will tell you that dental and vision are basically not covered under Medicare. And you need some other way of having those procedures covered, and we can help you with that and save you money. Thanks so much. Give us a call. We'll talk to you. Our number's at the bottom of this video, and I think you'll get some good information by calling us and support your needs. Thank you.